Coming up, we'll be on location at Weston Cosmetic Surgery Center in Weston, Florida, discussing the latest advancements in cosmetic surgery and how they can help you look younger and get the body you've always desired. With one of this area's leading plastic and cosmetic surgeons, Dr. Charles Messa. Dr. Messa is board certified by the American Board of Plastic Surgery and received his Doctor of Medicine degree from the Pennsylvania State University College of Medicine. He is a member of the American Society for Aesthetic Plastic Surgery and the American Society of Plastic Surgeons, among others. Welcome, Dr. Messa. It's a pleasure having you here on our program.
Thank you.
Can you please begin by telling us what some of the latest advances in cosmetic surgery are?
Today in cosmetic surgery, we focus more on rejuvenating the face through fat redistribution. In aesthetic surgery, we're looking to use adipose or fat cell derived stem cells to rejuvenate not only the face but also to enhance other structures in the body like the buttocks, the hips, the thighs, and even into the breast. Commonly that's done in a procedure that's been termed a mommy makeover, which is becoming very, very popular, where patients who have had children have maybe lost some weight, lost some volume through fat loss and through skin stretching with pregnancy, do abdominoplasties, breast enhancements with augmentation and lifting, or mastopexies. Those procedures combined with fat transfer and skin excision have really made patients look and feel much better.
How are these procedures performed?
These procedures are typically performed under some type of anesthesia, either with an intravenous sedation or a general anesthesia. They can be performed under local anesthesia, doing regional blocks of the areas with local anesthetics, depending on the extent of the procedure. In our facility, we have the opportunity to do procedures in an office-based facility because it's a certified accredited facility, but I offer to patients the ability to do the procedure in the hospital depending on their current medical condition and comfort level.
What are the advantages as compared to traditional options?
Traditional plastic surgery, when I say traditional, I mean going back to the earliest of time, had to do with just removing and tightening skin. Nowadays, it's not just about removing skin, it's about filling areas that are lost, trying to build structure, beginning with the bone level and moving up to the superficial skin. The classic example is you have a patient bring in a picture how they looked when they were a child. Child's face is full, it's round, and then you take a picture of an elderly person where you see that there's a more drawn look, there's deeper eye sockets, hollow cheeks. What that results from is a lack of structural support over time, loss of facial fat, and then loss of collagen and elastin in the skin, which results in sagging. So with these newer techniques, we're not only tightening skin, we're rebuilding the structure of the face. Therefore, the results last longer, they look more natural, and we're really addressing the main reason or the factors that are involved in the aging process.
Interesting. Who would you say is a typical candidate for this?
Typical candidates for plastic surgery are obviously patients who are aware of the risks involved and the benefits to plastic surgery, who are ready to take that step to make themselves look and feel better. That's number one. The other major factor is someone that has something structurally they don't find attractive that can be enhanced or improved upon with the present surgical techniques that we have available. So a patient, say, who's noticed that their skin has become more lax, they notice that they have some hollowing in the face from loss of facial fat, is a good patient to begin considering either soft tissue fillers or some type of fat grafting procedure. Someone who is in their late 30s, 40s, that starts to get a little bit of skin laxity may just do well with fat transfer. Someone that's maybe 40s to 50s who has more laxity in the skin, more sun damage, more of the aging process that is evident, would do better maybe with a mini or a short scar facelift combined with fat grafting. As far as the body contouring procedures go, most commonly you'll see those in younger patients after pregnancy, say a woman who's had her children, she doesn't plan on having more children, who's now in her early 40s, maybe late 40s, who now notices that it has stretch marks and loose skin, who wants to get rid of that and to reshape her hips, thighs, and buttock region. Again, skin excision through abdominoplasty or tummy tuck, combined with a liposculpture of the hip waist area where the fat is in excess, and then reshaping the thigh buttock region with fat grafting or fat transfer. So there's a whole gamut of ages of patients who are good candidates for cosmetic surgery. It's more important to listen to the individual patient's concerns and to try to meet their individual desires with what's the best procedure to give them the proper outcome.
Impressive. The results look very natural. What is the typical recovery time?
Typical recovery time for a fat transfer, fat grafting, would be 2 to 3 days, depending on the extent of the surgery that's done. If you're talking about a small area of the face, it can be done under a local anesthesia or with some very light intravenous sedation for patient comfort. It could be expect to be a little swollen, maybe a little bruised, depending on the patient. For 2 to 3 days, at that point you can wear makeup and look pretty good and be out functioning normally. For patients that have more involved procedures involving skin excisions, say a facelift combined with fat grafting, may expect 1 to 2 week recovery, again depending on patient's age, the extent of bruising and swelling, but minimally a week. Patients that have body contouring procedures through abdominoplasty or fat grafting can expect a little bit longer recovery because usually muscle tightening is involved, which will take probably 2 weeks to get back to a fairly normal routine, with 4 to 6 weeks to do strenuous activity and exercise.
Are there any follow-up visits?
I like to see my patients the day after surgery because the first 24 hours are often very critical in ensuring that they're doing the right things, getting the appropriate fluid replacement, and taking care of themselves appropriately. Then usually within 1 to 2 weeks, patients are seen again, depending on the procedure. And I also encourage patients that if they have questions or concerns, that my staff and I'm always available 24 hours a day for their concerns. And if they do, there's no set time you need to come in, but I encourage patients to come in when they have concerns so that they can be reassured and they can heal appropriately and look great.
We're now going to talk to some patients of Dr. Messa to find out how their experience was at the Weston Cosmetic Surgery Center. Welcome, Tammy. Thanks for joining us today. Why did you decide to see Dr. Messa?
I came to Dr. Messa for a number of reasons. One is that I decided that I wanted to get myself back to where I was before I had my 2 children, and I exercise and I eat well, but I just couldn't get my body exactly where I wanted it to be. And he had such a good reputation in the community, and when I came to see him for my first consultation, I felt so comfortable with his professionalism and with his abilities to get me back to who I was before I had my kids.
How do you feel about the results?
I'm ecstatic about the results. They really exceeded my expectations. I'm so happy with how natural I look and feel now, and the ability to wear almost anything I want to wear without having to worry about the unevenness of a fit of an outfit. And I just feel that it couldn't make me feel any better that I do right now with how everything came out.
How has this affected your self-esteem and confidence?
I've always had great confidence, but I feel that since my breast augmentation, it's given me a chance to regain my youth and to look the way I feel inside on the outside. And I'm really happy now to know that I feel exactly the way I want to feel every day when I wake up, knowing that I look how I once did before I had my 2 kids.
Can you please tell us more about your experience here at Weston Cosmetic Surgery Center?
My experience was fabulous. From my first consultation through my post-op procedure, every part of my pre- and post-op surgery was amazing. I was really impressed with the facility. It's clean. I felt completely safe, and every question I had was always answered by everyone in a very timely fashion. I had an overall amazing experience. I actually brought a little gift back to everyone in the office because I was so happy with how I was treated. I really felt that they cared about how I felt, and I was definitely not treated like a number. I was really felt very warm, and his bedside manner is absolutely amazing.
Thank you, Tammy, for coming out today and sharing your experience with us.
Thank you. Thank you for having me.
Welcome, Mara. Thanks for joining me today. Why did you decide to come to Dr. Messa?
I had just had my second son, and my girlfriend had her breast augmented and lift, which is exactly what I needed, and she was actually needing to go and have them redone, and she was telling me that she was going to Dr. Messa, and I had heard his name, and I had seen several physicians, and I hadn't found one, and when she was finished and I saw the before and the after, it really was an easy decision to make, and I came in and just loved him.
Would you recommend this procedure to other viewers?
I would, and I have, for both procedures. But I always preface it by saying it's really got to be about you and for you.
Can you please tell us about your experience here at Weston Cosmetic Surgery Center?
I love it here. Everyone here has always been just tremendous and caring, whether it's right after the procedure. Anyone that answers the phone knows who I am, knows what has happened recently. Everyone's so lovely. Dr. Messa, he sets the standard, of course, because he comes in and he just lights up the room, and you just know he's worked all day, and it's 7 o'clock at night, and he's smiling and he's happy, and it's so authentic. And everyone here, I think, works with that vibe. Everyone here has always been nothing short of just wonderful.
I want to thank you, Mara, for joining us today. Welcome, Alicia. I'm glad to have you here today.
Thank you. Thank you for having me.
Tell me, why did you come to Dr. Messa?
I was recommended by friends. They came and I thought they looked great. They were so happy. So I decided to come and meet him.
Mm-hmm. And what did you have done?
I had my shin done and my eyelids, and I loved it.
How has this affected your self-esteem and confidence?
Oh, I'm much more confident. I'm just happy. I look good, and I look as good as I feel.
Wow.
The other day I passed by glanced at a mirror. I was walking by the mall, and I just glanced and saw my reflection, and I said, gosh, that's me. And it brought a smile to my face. So it's been great.
Thank you, Alicia, for sharing your experience with us. Dr. Messa, the patients seem very pleased with their results and their experience here.
Thank you.
Both you and your practice have achieved reputations of excellence in cosmetic surgery and patient care. And I wanted to ask you, what separates you from other practices in this area?
At our practice, we offer personalized care and a feeling of warmth and compassion that is extremely important when you're going through such a important procedure that will oftentimes lead us have someone have an improved or enhanced self-esteem, maybe an area that they're concerned about and it's caused them some anguish over the years. It's important to be in an environment where people are warm and caring, but also to have the experience and the credentials to provide safe and outstanding results.
That was very informative. Thank you for being a guest today on our program.
Thank you.